May is Mental Health Awareness Month, and this week, Ohio Congressman Amelia Sykes just introduced a bill that would continue a program that provides tens of millions of dollars that would hopefully increase the number of behavioral health professionals. The funds go toward the Behavioral Health Workforce Education and Training Program. Joe Caruso joins us now. He is the CEO of Compass Family and Community Services. Thank you for joining us here at 5.
Lindsay, thank you for having me.
Yes,
and thank you for addressing this most important issue.
Absolutely. Explain why it's so important that the Congresswoman introduced this legislation to keep the funding going.
Lindsay, there is an absolute shortfall in the workforce that we are having very difficult times meeting the demands of people in our community. And these funds create a significant pathway to not only expand and get new people into the workforce, but also maintain the staff that are there that are committed to the life-saving services that our community needs.
Are you concerned whether this legislation will make it through Congress, given that there have already been some cuts that we have seen to so many other programs?
Well, Lindsay, from what I see and understand, it's a bipartisan bill that's been put forward. And, I would ask all of our legislators here in the Valley and throughout the region to support this bill. I know that when we have healthy individuals, we have healthy communities, and we have healthy workforces. And there's nothing more important than having people be healthy.
What are some of the root causes to the shortage and the need of more professionals in this field? What are you seeing, and why are folks maybe not staying in it or getting into it?
Well, I will say from getting into it, historically, it has been a field that was underpaid in the past, and people getting their master's degree and having student loans and being able to pay back those student loans on what the reimbursements were was a hindrance. That has been improved somewhat here in Ohio, which has been a good thing. The other issue is dealing with retaining of staff. They're doing very traumatic work in helping individuals with their behavioral health needs. And helping them stay healthy. And there is a level of burnout that occurs with working with the severely mentally ill, as well as working with people who have experienced significant traumas.
Yeah, we saw that across the healthcare field when we got out of the pandemic and even during it. Real quick, I'm wondering what kinds of training you offer for behavioral health professionals in order to provide the quality of health that we need for individuals.
Well, we offer a number of in-house trainings, but we also are very active in getting our staff out to professional seminars, to other activities. There's an activity going on today, which is the ASAP Coalition in Trumbull County with the ASAP annual meeting, and getting new and advanced information of treatment opportunities, treatment techniques is very key to helping the staff be able to continue to navigate this very difficult landscape.
And who are the patients that you're worried about slipping through the cracks? Are there certain types of conditions or issues people are facing locally that you think really does need addressed and this would really help with?
Mental illness and behavioral health disorders do not discriminate. It runs the gamut for children, and adolescents, and our seniors. Everybody experiences some sort of behavioral health disorder or event during their lives, and 1 in 5 Americans suffer from having a mental health or behavioral health illness. And really no one can we afford to let anybody slip through the cracks, because again, we are providing these life-saving services to our community, and it means life or death for many of the people that we serve.
Yeah, you see it with a lot of different families, that what they have to go through. Joe, thank you so much for being here and taking the time to join us on this important issue as we take a moment this month to focus on mental health. The people who care for folks too are just as important. Thank you for being here.
Thank you so very much. We appreciate it.